Hello, and welcome to The Public's Health, the show that puts you, the public, into public health. I'm Dr. Tony Iton, the Director and Health Officer of the Alameda County Public Health Department, and this show is a production of the Alameda County Public Health Department. Today we're following up on a theme that we started last month, looking at the health of moms and kids. In the public health, we do a lot of programming around mothers and children, but frequently we don't talk about the dads, and we're lucky today to have two programs that are going to talk specifically about how males get involved in that whole process. And we're also going to talk about a very important nutritional and health component of raising healthy children, and that is breastfeeding. We're joined by wonderful staff from the Alameda County Public Health Department, Lynn Diana, the director of our breastfeeding program, Reggie Bridges, who's integral in our IPOP program, working on the boot camp for dads, and Pedro Naranjo, who is the director of our male involvement program. Welcome. Thank you all for being here.
It's great to be here.
Thank you.
I'm going to start with you, Reggie, and you run a very unique program. Tell us about it and why it's important.
Well, I run the boot camp for new dads, and the boot camp for new dads comprise of rookie dads and veteran dads involved with their children. The veteran dads come back with their children, which are about 2 months old, and obviously the rookies are the ones that are expecting. The veterans come back and they showcase their babies, and they show them the quick tips of how to comfort a baby, how to basically take care of a baby, and to let them know some of the quick, like I said, the quick tips, you know. And this particular program has been around for a little while now, and we, as Alameda County, was the first in the Bay Area to get licensed for the boot camp for new dads.
Wow, that's fascinating. Now tell me, why are dads so important to this process? I mean, the mom has the baby, and does the breastfeeding and all that sort of stuff. What does dad have to do with all this?
Well, our particular program looked at the family as a whole, and holistically we felt as though the fathers needed to be involved. And when we went inside the home, there were some fathers. And anytime that you have a baby, there's a father. So we just felt like we wanted to address some of the issues that some of the fathers had. And so by having the boot camp for new dads, this gave them an involvement with their particular children early on. And research shows that if the father is engaged from the very beginning, he'll be engaged with that child for a lifetime.
Great. Pedro, the male involvement program, what's that?
So the male involvement program is one of many very, very exciting and innovative programs within the public health department. And I say it's exciting because here we're taking a look at how we can involve men, but how can we involve them at an early age in family planning and reproductive health. Historically, as many of us know, we focused on the woman. So now we're starting to recognize the importance of having a young man involved, having men involved before, during, and after pregnancy. So the involvement before is very important. There's several reasons why it's important to involve young men in reproductive health. The first is oftentimes young men influence sexual behavior and contraceptive use. We've found that increased use of condoms has dramatically reduced STIs and HIV. So if we want to increase condom use, we have to really take a look at involving men in addressing issues around attitudes and behaviors related to contraceptives. Okay, so that's one important reason why men need to be involved. Another important reason is that young men are also affected by teen pregnancies. Okay, so we know how the baby's affected. Babies tend to be low birth weight, they tend to be premature, and there's a lot of health consequences associated with that. There's also consequences for the mom. Teen dads are also affected. Teen dads tend to be involved in more illicit activities, illicit behaviors. They tend to have problems completing high school and problems getting employment. So we see young men being affected, trickling down to the whole family. And then another reason that's also very important, we found that young men want to be involved in reproductive health. They want to have more information. They want to go out and provide important messages to their communities about reproductive health.
Great. Well, that's really innovative. It's something that people often don't think about. How do you actually involve the male in all of this? Lynn, you run a program that tries to encourage breastfeeding. Why is that important?
Well, historically, humans have always fed their infants with their own milk. It's part of our species, and the milk is very specific and to meet the needs of that infant. And somewhere in the middle of the last century, around the World War II era, doctors started recommending that women use cow's milk, basically. At that time it was evaporated milk, usually mixed with some sweetener, and put into a bottle and fed the baby that. And eventually that evolved into what we call today formula. And we shifted from feeding our babies with our breast milk to feeding our babies with these bottles, with the formula. So historically, we made a shift in the last 40 or 50 years. And what we found out in the beginning around early 1990s was that the rates of women breastfeeding their babies globally, including the United States, had dropped so low that it became a major public health concern. And so programs were started at that point to help encourage and increase people's awareness, and also to do more research. And basically what they found was that the formula is causing a lot of illness in our babies that isn't present when babies get mom's milk.
We're about to see a segment involving doulas in France. Tell us very quickly what the role of a doula is.
Yeah, it's interesting because a doula, very simply, is a woman who stays with a woman during the birth and also can be there prior to the birth to work with the whole family, the fathers included.
Great.
A doula is a woman who preferably had children herself and who is there to support another woman during childbirth and the parents and the father as well during the whole process of pregnancy, birth, and all the postnatal time once the baby's at home with the parents. Even if there's problem during the pregnancy, during childbirth, or maybe afterwards with the baby, as long as the parents are in control, for women confident about their ability of the bodies and their ability in the whole process of becoming a mother, the experience can be very empowering. The experience of childbirth can be sometimes traumatic, and the trauma can be kept by the woman for months, for years sometimes, without being able to talk about it. Because at the time of birth, the information was not given to the woman, what was happening, what was done to her, what was done to her child. And all that can be avoided if, first of all, if the medical team is open and can inform the parents what's happening throughout the different stages of the birth. And if they have the support as well of a person who is non-medical, but who's just there to be a reassuring presence, who can comfort them, encourage them, and bring a bit of normality sometime in the whole process. What I find in France is the breastfeeding rate is very low, because breastfeeding up to very recently was not an issue in France. For the past few years, there's been more interest from the health professional into breastfeeding, but the support after you leave the maternity hospital is still not enough. There are things put in place for the woman once she gets back home, pediatric nurses that are trained in supporting breastfeeding, but the support is very patchy, and very often women can't go out to get support for that. It's too hectic when they go home with the baby, and to organize sometimes just to go out the house is just too difficult. That's where I find that the support of a woman that herself probably had breastfed who knows how it feels to breastfeed a child, who knows all the questions we ask ourselves. Have I got enough milk? Is he gaining enough weight? Is my milk okay? Am I giving him the breast too often, not enough? Should I keep my baby next to me, or being told that it's better if the baby's put down in his own crib, or all those questions. I think to have somebody next to you who had breastfed children, who can reassure you that what you're doing is fine, help them to feel confident about her body, show her ways of bringing baby to the breast, and to make her comfortable, to reassure the father as well. Baby's not sleeping throughout the night yet. Well, yeah, it's normal. It takes a while before they do that. That's part of the course. Childbirth and the arrival of a baby is a time where, as a human being, we need a tremendous amount of support, especially when it's the first time. And the more people can rally around pregnant parents to offer them the support, and not advice, but just support and understanding, the better is for this family, for this baby, and on the whole for the society. The most rewarding thing for me to be a doula is when the parents don't need me anymore. And the quicker, the better. And for me, even for example, if they wanted me to be at the birth, and finally, when labor starts, they don't call me, it's because they didn't need me. And for me, that's really the best thing that can happen for me. That's for me that, yes, I did my job well. And when they really feel that they did it themselves, that's for me, that's my reward. Voilà.
Watching a reality show, 1 hour. Watching a baseball game, 3 hours. Getting the results of an HIV test, 20 minutes. 1 in 4 Americans infected with HIV don't know it. Learn your HIV status in 20 minutes with the new oral swab screening test. Take the time to take the test.
Okay, so continue in educating us as to what a doula is and the role that a doula plays.
It's a very important role, and historically for humans, women in the past have always had women around them, midwives, aunties, anyone that has had a baby and has experience with raising that baby or birthing the baby could be of great help to a new mom. It creates an opportunity for the woman who's giving birth to have someone there to just support her. In some studies, they found that just simply having any woman present decreases the negative aspects of birth or any complications of birth. Doulas are specifically trained with an international set of standards, so they are doing a lot of health education as well as just answering simple questions for the parents, like, is the baby getting enough to eat, and why is the baby crying so long, and when is the baby going to sleep, overnight.
And do they help with breastfeeding?
Yes, they do. They're there in one of the important aspects of breastfeeding is that the mom have a model. So doulas hopefully are someone who's already breastfed themselves and has also been instructed in it. And they can reassure the mom that what she's doing is fine. They can make small corrections. They can teach the dads about what breastfeeding is about and how to be comfortable with it, what to expect. So yes, so prior to the birth, there can be a lot of education that happens, and then right at birth, which is a very important moment actually for that baby and mom, is the opportunity to put the baby to breast right after birth. So when the doula is there, there's a much more likely that the baby will be put to breast to at least have that initial introduction.
Now you've done some interesting things in Alameda County and in Berkeley around big breastfeeding events and that kind of thing to encourage
Yes.
breastfeeding.
Yeah.
We're going to see in a minute or so a segment on how you get data around breastfeeding rates in Alameda County. Talk to us a little bit about that.
Well, one of the things that we're looking at is how can we promote breastfeeding, because our rates, like in France, are quite low still, and so we're working on that. And one of the ways we measure how women choose whether to breastfeed or bottle feed their baby is in the hospital when they come around with the birth certificate. There is a question on that questionnaire about the mom's intention to feed. What is she going to choose, breastfeeding or bottle feeding?
Okay, so let's see a little roll-in on how we collect that data.
Birth certificates are a legal document used for many, many things. For those of us who are baby boomers, a certificate will need to be provided to the federal government to get Medicare and Social Security. If you want a passport, you need to have your birth certificate. A birth certificate needs to be provided to the school when your child enters. Your child would like to get into Little League. They're trying to keep all the ringers out, so they make you provide a birth certificate. Those into genealogy would find it just horribly difficult if there were not birth certificates. In the year 2007, there were 14,103 births in the Alameda County area. We have 7 birthing hospitals in Alameda County that feed their records to us. A lot of information is gathered on birth certificates that lends itself very easily to the interest of statisticians, epidemiologists, and all those who would study the progress of healthcare in our county and the state of California, such as the number of prenatal visits and the month the prenatal care began. I'm sure a statistician would be able to find a correlation between how much prenatal care had been given and at what month it was begun.
This is a process of home births. First, parents contact our office, and then I call them back saying if they have all the information, they could fax it over to our office so I could put it in the system. Once I put it in the system, I call them back and arrange for appointments here in the office. So they have to bring the baby. Both parents are okay. If they have a midwife, the midwife can come in too to sign all the birth certificate. We need the verification of the birth and also their IDs, also bills, like utility bills, saying that they were actually living in that house or residence when they have the baby. And then after that, they come in here, I check their IDs and all the paperwork, and then I print out the birth certificate and they check if everything is fine, then they could sign it and that's it, we register it.
I'm a senior citizen and I'm definitely getting enough water, that is. To prevent dehydration, I drink 8 glasses of water a day. Fill her up, dear. Most of us need 6 to 8 glasses a day. Ask your nurse or doctor how much water is right for you. Make sure you are getting enough. Cheers.
So Lynn, very creative program that you run. Tell us a little bit about some of these events that you have staged around breastfeeding.
Well, we do a number of things. I mean, I think our biggest event was several years ago. We got in the Guinness Book of World Records for the largest group of women breastfeeding. We got almost 1,300 couples, mama and babies, into one venue, and they all latched on at the same time. And we got a tremendous amount of publicity around this, which was really good because our programs are trying to promote and support and protect breastfeeding. And this was an opportunity to bring parents together who are breastfeeding, because sometimes they feel alone, and let them kind of share ideas, and we had health education going on. And it was a lot of fun. We were actually competing against a record that had been set by Australia, and we got I mean, it was a lot of people. It was a tremendous variety of people. We had dads there. We had the siblings were there as well. But I think our main communication for people is that breastfeeding is the healthiest way to feed your baby, and that many others are doing this, that you're not alone,
Great.
and that there are resources.
Great. Reggie, your program also very creative. Tell us a little bit more about how you do what you do.
Well, one of the things that we do too is that we have a segment about the breastfeeding, and we also encourage the men to encourage their girls, their women, their wife or significant other to breastfeed. And with her absence, we also say that we want the guys to do the skin-to-skin contact if the mother has pumped their breast and whatnot, so the father can take care of the baby in the absence of the mother.
Yes.
So that's one of the things that we do as well. We highly emphasize the fact of breastfeeding being very, very vital. And so we also want that warmth to be there so the man can be involved where he won't miss out on that nourishing part for his baby as well. So that's some of the things that we do in there as well. Inside the class for the boot camp, there's no females in that particular room taller than 2 feet. So they have to be babies and whatnot. And in that particular room, there's a lot of things that come out, a lot of different questions, a lot of different concerns. And some of the concerns were, I like to get my wife involved with breastfeeding, but I don't like the idea of her exposing her breast. Those are some of the concerns that were said. And we let them know that the wife now can do it in a way that she's not exposing her breast. And those were just some of the concerns. And that's some of the things that we cover in the boot camp as well.
Great. Anything else that you do in the boot camp?
Yeah, the boot camp for new dads, we go through all of the various steps of comforting a baby. If a baby is crying, what steps do you go through? Obviously, you may try to find out if the baby is hungry. And if the baby is hungry, you feed them, then you burp them. If the baby needs to be moved around, because the baby wants to have a better visual than just being on her back, his or her back, so we encourage that. We also educate the guys that if the baby is still crying, maybe the baby has gas, and some of the techniques that you can do to eliminate the gas, such as bicycling the legs and whatnot of the baby. And then some of the guys will sing to their baby, just the warmth of singing to the baby. And that's what we tell some of the veteran dads, tell the rookie dads to get involved like that. So those are some of the things that we do.
Oh, incredible. These are both 2 incredible programs. Pedro, yet another incredible program. Give us a sense of what one would experience if one was participating in the male involvement program.
Good. Well, I think a big component of the male involvement program is role modeling, sort of what Reggie has just described, where staff, volunteers, any positive adult male role models that come into contact with the young men share their stories, being a husband, being a partner, being a dad. And in sharing those stories and in sharing our experiences, they get to see what's important to us. And they get to see how we're involved. They get to see why it's so important, to the point where when we see these men week after week, that's one of the first questions that they ask. How is your daughter? Okay, and I think that's pretty important, because somehow, some way, we're instilling in these young men the importance of being an involved father. We're instilling in them the importance of being an involved partner, talking to their girlfriends, talking to their wives when they do get married, about the importance of making those family planning decisions together. So the trickle-down role modeling effect then happens from them to then middle school kids, where the young men involved in the male involvement program go through a leadership development program, okay, where they're taught about they analyze, or they think about who they are, self-reflect on who they are, how they interact with other people, how do they make decisions. And then the idea is to develop messages for their peers. We know that young people listen best and absorb messages from other young people that look like them, that have gone through similar experiences, and that are not too far different in age. Okay, so when you have a young man go in front of a classroom that's full of males and females, middle school students, and the young man is saying, I'm responsible for preventing teen pregnancy. I'm responsible for being involved in my son's life when he or she is born. I think that's a powerful message that young women get to hear. Because traditionally, the person will think it's the woman's responsibility. So the young woman is receiving this very important message. At the same time, the young men in the classroom are hearing other young men say, you need to be involved. So we're changing attitudes, we're changing norms to the point where someday the question is going to be not, why are you spending so much time with your kids, going to the park? It's going to be, why are you not spending enough time with your kids? So a lot of role modeling. And that's what the young men get from this program. They get a sense of pride, they get a sense of belonging, they get a sense of influence. When they get to go out to the community and improve their community, that I think that raises self-esteem, that raises confidence.
So very briefly, in the few seconds we have left, what do you want our audience to know about your programs in 2 words or so?
Well, I want young men to know that our program is out there, that it's free, and I also want them to know that we also have a raffle where we raffle off baby car seats and so on and so forth, and it's a wonderful time. It's an opportunity for them to engage, ask a lot of questions among other men.
Great.
And
thank you so much for all of the guests that have been here today. Thank you for tuning into The Public's Health. This is the second of a 2-part series, a two-parter on maternal and child health and the role of dads. Thanks for tuning in. Bye-bye.
And now, another episode of Pandemic Detective.
My client wants to know when the flu pandemic will arrive. I don't know, but I don't guess. I get ready by examining the evidence. Meanwhile, don't forget to wash your hands and cover your cough.
Brought to you by the Alameda County Public Health Department.